You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants, which is the newest trend in dentistry to replace missing teeth. With us, we have an expert on the topic, Dr. Lynn Lee. Dr. Lee, welcome to the program.
Thank you for having me, Randy.
Now, we didn't mention, but also you say no more dentures.
That's
no
right.
more traditional dentures. So now for people that don't know your practice, and I've got a lot of questions about these mini implants, who's your typical patient now? And what are the different services you offer in your practice?
You know, I'm a general dentist and I've been doing this for 20 years. And, you know, I have patients from all walks of life. We're in Los Angeles, so it's a diverse group. And we have anybody from teachers, engineers, people in the entertainment industry, stay-at-home mom, grandmas, children, youth. So we do general dentistry for everybody. But a lot of the people come to me for two reasons. One, because they've been suffering and they want a beautiful smile, and I can transform their teeth and give them the smile so they can eat and chew and laugh with confidence.
You do a lot of cosmetic dentistry, right?
Yes, I do.
I mean, you're like big, and in fact, that's what you wanted to talk about on my show.
Yes, yes.
You're like the cosmetic person.
Really, that's been my passion for 20 years. You know, people who are unhappy with their smile, you know, or they've gone to many dentists and they've just had, we call it their mix match patients, where they have a crown here or two crowns there, but nothing looks good. So, you know, in a couple of weeks, they can really have the smile of their dreams. And then the second group of people who come to me specifically are people who don't have teeth. They're suffering with dentures, top and bottom, or they know they're going to be losing their teeth.
You love these mini implants.
Oh, I do. I mean, I'm going to tell you this.
Okay.
5 years ago, I wouldn't have been able to give some of these people these options. But with mini dental implants, now these people who don't have teeth, they can chew and eat and smile with confidence. They don't have to suffer with loose-fitting dentures anymore.
You're in the San Fernando Valley. Are there a lot of people that are either headed to dentures or wearing dentures where you are?
Absolutely. I mean, I don't know, this show that you air, hopefully, what do you think? You reach around 25?
Well, we hit 5 million homes and about 20 million people plus.
Yeah, I'm going to tell you this. Probably 1 million of those people, and that could be a low figure, are suffering with dentures, top or bottom. Or they don't even have any teeth, or they've been suffering with their loose teeth and know that they're going to go into dentures. The ADA put out a study that says 50%.
What's the ADA?
American Dental Association.
Okay.
They put out a study to say that 50% nationwide of the population suffer from some type of gum disease, which will lead to bone disease, which will lead to bone loss, and then tooth loss. So a lot of those people
So like the
are
bleeding
gonna have
gums and
teeth.
all that stuff?
Yes.
They're headed to lose their teeth?
Yes, one or more teeth. So that's why I'm so happy to be here today.
About mini implants?
Yes, because to give patients hope, to give them an opportunity to learn more, that there are choices and real solutions out there.
Okay, if there's so many people, and I've had other people on the show, and I'll ask you the same question, if these mini implants in this particular case, not to be confused with traditional implants, but if mini implants are so good to, I guess, you know, to secure a denture, why aren't they all doing it?
I'm going to tell you this. Most people who have dentures don't go to the dentist, right? They only have their teeth and their gums, and they might come in, you know, every 5 or 10 years if they're loose or they're broken or they need another pair. So a lot of times they're out of the loop, okay?
All right.
And the other portion of people, they have had dentures, but they're just done with dentistry, right? They suffered with their teeth for so many years, going to the dentist, not having any hope. They're like, just let me get rid of this, and I think that's it. So they have no idea that there are these options out there that can help them. And I'm going to tell you, the third reason, and one of the biggest reasons in my experience, are people are ashamed. They're afraid. And I call these patients of mine that finally come in to meet me the silent sufferers, right? Because they think there are no other options, that they are not going to be able to eat and chew, and they're really embarrassed. This is not something that a lot of patients can even talk to with their spouse. You know, if people get cancer, if they have even prostate cancer, it's something that you can tell other people about. But with dentures, there's a stigma about it, and people are very embarrassed. It's not something that they are proud about, and a lot of times they feel judged.
So you don't like dentures, personally?
No, I don't think anybody likes dentures. I think denture wearers don't like dentures. But, you know, that was their only option. But now there are these mini dental implants that will help the dentures attach to something, so that they can eat and chew and smile with confidence. I think a lot of us, you and I, who have our own teeth, we can't even begin to imagine, all of the suffering that these people are doing silently. It's because we speak, we can go out to dinner, we can connect with people and friends very easily. It's not even a second thought for us. But for a lot of these patients, it's a real problem. I had a patient come in the other day, and he had dentures, and he finally came to see me. He drove all the way, I think, from Temecula, to come up to see me. And this is what he said. He said, you know what, these dentures, I'm suffering with them. I can't even go bike riding. And I'm like, oh, really? Why can't you go bike riding? He goes, every time I go over a bump, and I'm afraid my dentures are going to fall out. And then I can't even scream because I have to go like this in order to keep my dentures in. So these are things that you and I, or people who have teeth, don't even have to worry about. And so I listened to all these stories from all my patients in the past 20 years. And I realized that this is really a true problem, and they need true solutions. And I think mini dental implants is that solution.
But I've seen some of these before photos of yours, and it seems like it's got to be unusual for their teeth to be this bad.
It's not very unusual. I think a lot of people suffer with bad teeth, and a lot of them come in and they're embarrassed, especially the men. They all have beards or everything that's covering their teeth. And so a lot of times, when they realize that I've seen many of these cases before and that I can help them and that there's hope. There's been people who just even before I've done the work to tell them that there's hope and that I can transform their mouth so they can eat and chew and smile again. I mean, some of them, are there crying, because they're like, I've never heard that before.
So the reason they never, they think they're the only one is because these people don't smile? Is that what you're telling me? Like when they're walking around, they...
No. I've had patients who have said that, you know what, I haven't smiled for 20 years. When I take photos of them in the beginning, like I said, I'm going to take, preliminary photos, and then I'm going to take some afterwards. Sometimes as I'm taking photos, they're like, oh my gosh, I haven't had this many pictures taken of me for 20 years. So, there's a lot of people. I mean, to me, I'm smiling all the time. You just think that a smile is something that you use to connect to people. But a lot of people are afraid to smile.
Are there a lot of people even wearing dentures that don't like their dentures, like the appearance of their dentures?
Oh, of course, most of them do. But you know what, I always tell people this, I specialize in cosmetics, so I will make them the best looking denture there is. We use quality labs, and that's my passion, the artistic part of, making their smile beautiful. But the function part of it too. Now
what do you
not
mean
only
function?
can it look good, but now they can eat and chew with confidence. I'm going to tell you, maybe 5 years ago, I told you I specialized in all these smile makeovers, right? But there was that niche of patients, especially my denture patients, where I couldn't help them past just making them look good. But now with mini dental implants, you know what? They can chew, they can eat, they can connect. I had this patient, she was going to a wedding of her granddaughters. And she came into me, she was like, I don't want to go to the wedding. She wants me to talk. This is my favorite granddaughter, but I don't want to give a speech because I'm embarrassed that my teeth are going to come down. And I don't like my teeth. I don't like my smile. And I just don't know what to do. Is there anything that you can do? So there are people, look at this, there are limitations in their lives that this is their favorite granddaughter. And they're afraid to go and celebrate, with their family because they're self-conscious about their dentures. So, we did mini dental implants on her. We gave her a new set of dentures. And then
so when you say a new set of dentures, these are dentures that snap on to these mini implants?
Yes. So they snap on, and then and they have no palate. There's no plastic, so she can taste, her food, and now she could speak. She ended up showing me a video where he came back. Not only did she give a speech, she sang a song. And so she told me, in 20 years, I have not done any kind of public speaking. So it really changes lives.
How old can you be to get this done?
Yeah. Dr. Shatkin in Buffalo, who I trained with mini dental implants for. He's the guru of mini dental implants.
All right.
And he said, most of his patients are in the 70s and 80s, and he's even done mini dental implants on patients who are 100.
Why would somebody 90 years old want to do this?
Because they want to eat, they want to enjoy their food, they want to chew, they want to connect with their friends and family and be able to have the quality of life that you and I want, right?
But if somebody has been wearing dentures for 20 plus years, and especially with mini implants, can you still do mini implants? I mean, don't they lose bone if they've been wearing dentures for a long time?
Yes, but actually, they are the best candidates for mini dental implants. A lot of my patients, when I've sent them out to specialists to do the traditional implants, it requires ideal bone. And so they come back a little bit frustrated because they're like, oh my gosh, now they have to build up the bone and do all this surgery. And so they end up not doing it. But the great thing about mini dental implants is it works well on the people that don't have enough bone. The implants are smaller. Okay, so it integrates better.
But do they stay in there?
Yes.
I mean, compared to traditional implants, because my buddies that do traditional implants warn me about things like this.
Yes.
So where do they stack up?
There's a 10-year study. Look, there's a 10-year study out there that shows that mini dental implants and dental implants have the same success rate. And they're approved by the ADA, which is the American Dental Association, for permanent use. They've been approved with the FDA too as well. So, and then some of the best gurus in dentistry are supporting it. So there's enough research out there, clinically, research-wise, to prove that mini dental implants have the same success rate. And the other great thing about mini dental implants is it's affordable. I've sent a lot of patients out to specialists, and they'll come back and they won't do it. They're just like, some people don't have $50,000 to $75,000 to spend on their teeth. But
is this a lot less? Is this a lot less?
It could be a fraction of the cost or less than half the cost of traditional dental implants.
And they work.
You can get teeth that snap in top and bottom. And we haven't even begun to talk about the fixed teeth. So
with mini implants, you can do
fixed teeth where it's porcelain teeth.
Like a full arch of teeth for a denture wearer?
A full arch of teeth instead of dentures. So the next step, above the dentures are these roundhouse teeth, set of teeth, 10, 12 set of teeth that are cemented into the implant. So they never even come out. There's no plastic, there's nothing on the sides or on the bottom. So really they are the third set of teeth that you never had.
Yeah, but I know a few denture wearers, right? At least a couple. They don't complain. They seem to be fine.
Well, they're not going to complain to you, and I'm going to tell you this. A lot of them are embarrassed. They don't even tell their own spouse. I had this great story of a patient.
They don't tell their spouse what?
That some of them, that they are suffering with dentures, they don't want to mention it. They don't even tell their children that they have dentures. I had a patient come in the other day. She is 60 years old, okay? And this happens a lot with women, and this is what I see in my practice, is she said, I've spent my whole life taking care of my kids. They go to the dentist, they have great teeth, but they put themselves last, And so now when they're 60, everybody's all done. They're like, it's time for me. She had a denture, and then it was missing 3 or 4 teeth. I was like, oh my gosh. And she said, you know what?
The denture was missing teeth?
The denture was missing teeth because she said her children did not know that she had dentures all her life. It's not something that people talk about. When they come in, they share that story with me, their dentist, but it's not going to be something that they're going to talk about with their friends, or even, like I say, even bring up with their family or their spouse. Randy, I'm going to tell you something about the life of a person who wears dentures. Like I told you before, you and I who have teeth, we can't even begin to imagine all the things that they have to worry about on a daily basis, right? Denture people, when they go to a restaurant, they have to think, oh my gosh, what am I gonna order? They can't eat salads, they can't have nuts, they can't have steak. Most of the time, anytime the first thing that people wanna do after they have mini dental implants and a denture that's, is affixed to their mouth, is they're like, I'm gonna have a steak dinner
How soon
with
can
salad.
They eat?
You know what? They can eat that night.
Even with the minis, though, okay, after they're healed up, they could eat a steak.
Yes, they can eat a steak. Some people can have apples. They can have things that they can never have. Like the patient who said, oh my gosh, I went and had a Caesar salad with croutons. They're excited about croutons or almonds, in their salad. So it's a real concern and problem for a lot of these people. And you have to remember, we're in California, so a lot of people can't do a lot of outdoor activities, whether it's surfing, running, hiking, biking. They're always afraid, that their dentures are going to come loose. And then, forget about romantic relationships. A lot of people are saying, oh my gosh, I'm starting to date again. This is my second or third marriage. And, I'm really embarrassed about my teeth. So I have
So if they have a denture, they're probably pretty embarrassed. They're dating, right?
Of course.
Because they have to eventually tell the person.
Yes. And I'm going to tell you,
this is
a
good.
lot of people don't even tell the people that they have it. You know what I mean? But then they'll come in because now they're concerned and now they want something to give them a little bit more confidence.
Can they look real? Because I feel like I could spot a denture or veneers walking down the street.
No, not the dentures that we make, So I specialize in cosmetic dentistry. So the teeth are real, they look natural, they look beautiful. Whether it's veneers or dentures, they're gonna look beautiful.
Now you say you specialize in cosmetic dentistry, you specialize in mini implants, but these are not recognized specialties.
No, they're not.
From like the American Dental Association.
No, they're not. But I'm just telling you, that is the focus
That's
of
your
my
focus
practice.
of your practice.
That's what people come to me for. They seek me out for that because they know that I love transforming people's smiles. And now with mini dental implants, I can give them the smile that they want, but also give them back the quality of life.
They could chew.
Yes, they
What
can
about
eat.
chewy things
They
like
can
a pizza?
Oh yeah, now they can eat pizza, they can eat a caramel, and they don't have to worry about cavities, right?
That's worth it right
but
there.
Yes, but steak, salad, to eat, to smile. A lot of times patients will come in, the people who have lost their teeth or are losing their teeth. I'll see it, it's in their body language. They don't look at me, straight in the eye. There's definitely their self-esteem, is affected. And, once we finish, it's amazing, especially the men, they'll come in and they've trimmed their beard all around. Suddenly, you see their eyes. Like I had a patient last week, I'm like, oh my gosh, I see the blueness in your eyes. You can see it, the smile through their eyes and through their whole appearance. They sit a little bit straighter, they're a little more confident, they look you straight in the eye, and then suddenly you can see their charisma, or they'll tell you a joke. So all of these things that we see when patients are not self-conscious about their teeth.
Respectfully, right? You're a dentist.
Yes.
You probably think, let me guess, that the smile is the most important thing.
Yes, and it is. And I don't think it's just because that I'm a dentist. I mean, there's a powerful thing about a smile. We all want it, right? It's like, if I came in here, I did this interview and I didn't smile the whole time, There's a lot of things that you might see. She's not friendly.
That's a good point.
Right? I've had patients who came in and said, you know what, I think I'm not getting this promotion because of my smile. Because of that, it's limited me. I'm afraid to speak up. I'm always covering up my mouth. And they think that I am probably not as intelligent. So this is what patients tell me. And so when we change their smile and fix their teeth, suddenly they have the confidence to walk into a room and say, you know what, I deserve this promotion.
But if your gums are bad, I know traditional implants is okay, but what if you have bad gums and you want mini implants? It means you want teeth anchored onto those mini implants.
Well, you know what? The minute we get rid of all the diseased teeth, their gums and bone heal up. And so again, they become great candidates for mini dental implants because the mini dental implants are smaller and they're less invasive, so they also heal up faster as well.
Yeah, what about pain?
What about pain? You know what? I'm going to tell you this. A lot of times, a lot of my patients say that it's not as painful as they imagined, and a lot of times a couple of Advil that night and the next day will take care of it.
And during the procedure?
During the procedure, no, they're numb. It's just, there are patients, and not everybody is this way, but I'm going to tell you this just from my experience. Some of my patients are like, oh my goodness, you know what? This was less painful than a root canal.
Okay.
Yes. So we numb the area and we place in the implants. There's no surgery, there's no cutting. So we just make a tiny access and we place them passively into the bone. So a lot of times there's not a lot of discomfort.
And they could eat right away.
And they can eat right away that night or the next day.
Are they ever afraid to eat? Like saying, Doctor,
Oh,
are
yeah.
you sure?
Definitely. Patients will call me that night and they're like, oh my gosh, I accidentally bit on something. Are you sure it's going to be okay? And I say yes. Or they'll call me throughout the week and they're like, what about I'm going to go out today and I'm going to have almonds and cranberries. Is that okay? And I'll say, don't worry, just eat whatever it is that you want. And if you have any problems with it, call me. So it takes them a little bit of time to actually lose that fear of being able to eat naturally without worrying about it, but eventually they get there.
Now, I want to address as far as insurance, Medicare, Medicaid, because we've had this topic on the program before, and people send us emails and they want to know, is insurance covered by this? Now, the research I've done, I guess the best dental insurance, the maximum payout per year might be $1,000 or $2,000. That does not cover the whole cost. Number two, Medicare, Medicaid does not cover mini implants or dental implants here in the US. So with you have financing, things like that.
Yes,
Tell me
of
about
course.
that.
We have financing, so if you come in and we discuss the treatment, we will find every way to help make it work for you. So there's financing that allows you to pay over a year without zero interest. But I'm going to tell you this: a lot of people, they just come in and they know that there are solutions and it's affordable and it's going to be easier than they ever anticipated. That that they don't have to be fearful and that they can leave in a couple of weeks or so with teeth that are attached to their teeth. They will find a way to make it work. And I've never seen a person, once they realize, oh my gosh, these are the options, not find a way to make it work. And like I said, we have financing and we will walk them through it and figure out a way to help them get there.
Now, is this true? I guess men put things off more than women, right? And you told me they hold on to their teeth too long.
Yes.
Like they're miserable for years and years and years. And when they're finally in so much pain, they come and see you. Mm-hmm. What do you say to that group watching this?
To that group, I just want to say, look, at least just come in for a consultation. And I always tell my patients this, we're going to start today. Forget about what happened in the past. Forget about why you lost your teeth. But if you come in and give me an opportunity to show you that you can have the quality of life that you want, that you can eat and chew and smile again, and you don't have to suffer in silence, and that there are real solutions to your problems.
Now, you do a lot of this quickly, the same day. Is it because they're mini implants or is it because it's just the way it is today?
Well, part of it is mini dental implants, and it's because they're coming to my practice and I can do both procedures. A lot of times patients will have to go do implants and then they'll have to schedule with me, and it might be not for another 2 or 3 weeks until we see the results. But with mini dental implants, sometimes they can come in, we place the mini dental implant and the restoration that day. So within 1 to 2 hours, they walk out with the restoration already.
And they look good. When you say restorations, you're talking about a
crowns,
full bunch of teeth?
Dentures, full roundhouse, full set
What
of
does
teeth.
roundhouse mean, by the way?
Roundhouse means it's the rounded curvature of your teeth. So basically, let's say if you have 12 to 13 teeth, we can give you a set of new teeth, this set of, what did I say? Third set of teeth that you've never had. And it's all connected, it's in there, no plastic, no covering of the palate, and it never comes out.
We are out of time, but somebody watching this, and for whatever reason, they're still skeptical, right? Or they're afraid about pain or about cost or about they're too old or whatever. What do you say to them?
This is what I want to tell the patients out there, that if you're suffering with pain with your loose-fitting dentures, if you can't eat the foods that you want, if you're embarrassed, if not having teeth prevent you from the activities that you want to do, whether it's biking or skiing or singing, or it's limiting you in your ability to get a good job or connect with the people in your lives that you want, whether it's your children, your spouse, a new romantic partner, I would just want them to invite them to come in to have a free consultation. So we will come in, listen to their story, take a look at their mouth, and give them a customized options of what is possible.
What are the mini implant options for somebody that's already wearing a denture? Mm-hmm. Like they come in on the consult, what do you tell them?
You know what? If they have a denture that they love, sometimes we can place in mini dental implants and retrofit that day.
Using their own dentures?
Using their own dentures.
And just what, snap
yes,
it?
and snap it in. If it's a nice fitting and good-looking dentures. But most of my clients, they come in, the dentures are old and they hate the way that they look. So then what we would do is fabricate a new denture, and we would take molds and whatnot, 1 or 2 visits, and then the 3rd visit, they come in for an hour and a half. We just locally numb up the area, place the implants, and they leave that day with a new set of teeth that they can eat and chew and smile and feel confidence with. The part that I haven't shared with you is you should see the look on these patients' faces for when they see their smile for the first time. I mean, you will see grown men cry.
Really?
Yeah, or get up and give all of our assistants hugs. They'll call their family in, and sometimes families will gather in on that day to see them clapping or taking photos. But it's not only that day. Their life is changed afterwards. They always come back with stories. Oh my gosh, now I'm traveling. I'm doing what I want to do most. Oh yes, I just got married. I had a patient. That's what it is. She said, finally I want to do something with my teeth. I've been single for 30 or 40 years, and now I'm thinking about dating again. And now she got married and traveling the world. I mean, what is better than that?
You brought up a job. I'm going to back up a little bit. You brought up getting a job or getting a promotion several times. Yeah. How could your teeth do that?
Look, if you are embarrassed about your teeth, you are gonna be self-conscious. And if you're self-conscious, you can't be confident. You can't really be who you really are, right? Sometimes the way people speak or express themselves show their true personality, right? Their charisma comes through. Are they, somebody who is charming or not, or confident? All of that is shown through your smile. So if you are embarrassed of this part, you're not gonna be able to show your best self. I mean, I've had patients that have come in and, let me tell you this quick story, that she was a cellist. And she was only like 30 or 40 years old, but she had dark stained teeth. And so she always smiled like that. And again, she said, you know what? I'm finally able now. They asked me to be part of the Los Angeles Symphony. And again, she was afraid to take that job because of her teeth. So yeah, once we took care of that part of it, the sky was the limit. Now she's like
what, veneers or whatever?
Yes, whether it's veneers, and that's what we did for her. We redid the veneers so she doesn't have to have black stained teeth anymore. And I'm gonna tell you, even when she came in the first year, she's still going like this. And I said, why are you going like this? She goes, I know, I'm sorry. I go, stop apologizing. And